This is console, so that's one of our choices that we have for bone graft material. Obviously, a blood clot is a choice too. In this case, because we're wanting to maximize alveolar bone height, we want to get that bone height back up to the area where the marginal bone is now. We would want to use a bone graft versus a blood clot because, as you may remember, in a year's time, 1 to 2 millimeters of that marginal bone height will be compromised when we use just a blood clot. So in extraction sites, when there's no adjacent tooth, that's fine. But when we're working on a tooth like the one we just showed you, we want to make sure that we maximize that bone height and not lose that 1 to 2 millimeters, and so that's why we'd use a bone graft. Console is an osteoconductive graft. It just forms a matrix for the osteoblasts to attach to, increases the surface area there for those to attach. And so there are no components in there that cause the bone to grow, as opposed to another graft that I'll show you in a minute, which is osteoinductive, that does have components that'll help the bone to grow. So that is before, and then that's after. And if you guys remember this case, this was a Spitz that was in my general practice maybe, I don't know, 20 years ago. And we were able to follow this guy out for 7 more years until she was euthanized for seizures, and we'd get her back every 6 months, and this is what it looked like. We certainly want to follow the periapical area to make sure that we didn't have any endodontic disease. It just wasn't showing up radiographically yet. So every time we get this patient back for at least a year or two, we're going to pay more attention to that to make sure that there's no changes there that would suggest a problem. And this guy obviously did fine for that period of time.